our ARIA, one of our newest products in the LabX line of test kits. ARIA stands for Antigen Rapid Immunoassay. It's a product that can one day be a self-test kit, a home-use test kit. It's a single-use test, very simple to use, very easy to use, and painless. It is approved in Europe, by the EU, and by many countries around the world. We are very lucky to obtain the rights to OEM this and design it under LabX. ARIA comes from the name Maria. Second, ARIA is designed so that it can help with this pandemic. It provides a solution for decentralized testing, which can be done at homes and offices rather than in a central testing area. So we hope you like it. Its sensitivity is about 96% and specificity is about 99%. It's a very accurate test, affordable test, and truly accessible. A ubiquitous test that can be done anywhere in this country, anywhere in this world. ARIA. FINA AG. This is our flagship product or antigen test of LabX. FINA Antigen or FINA AG is a fluorescence-based antigen test where it provides a higher accuracy in detection. Instead of using our eye as a detector, it uses an analyzer, using a UV spectrum analyzer that can pick up the fluorescence created by the presence of antigen on the test. FINA, which really stands for Fluorescence Immunoassay, is probably one of the most accurate antigen tests in this country and in this world. It is a point-of-care test and one of the only, probably the first validated, RIT validated test kits that passed. It has a 91% sensitivity passing rate from RITM. On our third-party validation, it's about 97, and our specificity on our third-party validation is about 100%. From RITM, we're at about 97.3 overall, and 91 on sensitivity. But we are very proud to be the only passing RITM test kit in the market here in the Philippines. So that's the FINA AG, manufactured by our partners Lance Ion Biotech, based in Jiangsu. We're very proud to bring a new panel. And the panel basically is a set of test kits that is combined to provide a key solution in this pandemic. The CRP, the COVID risk panel. This panel of 7 tests basically provides doctors and patients information on your risk level against COVID or any viral disease in the future. This is a great test panel to ensure that we, the patients, have immunity against most viruses. It could be COVID, it could be pneumonia, it could be malaria, it could be any viral disease out there. So the CRP is here to provide a true measure of our risk and a true measure of our immunity against these potential viruses. What do we measure? The most important parameter we measure is your vitamin D. Hydroxyl 25-DD. Vitamin D has been tied to our success in surviving COVID. Most symptomatics who catch COVID are symptomatic because of one thing: low in vitamin D. Those who are asymptomatic, most probably they are high in vitamin D. Research also has shown that those who survive, especially from the ICU, severe cases of COVID, those who survive are those who have a good level of vitamin D. And those who do not survive were found to have low levels of vitamin D. So the measurement of vitamin D, together with all our other inflammatory and cardio-based panels, is key in this CRP panel. So we hope you promote this, we hope you use this. The CRP is an amazing panel to measure our immunity, our ability to fight this virus. Early is good detection, so we can either upgrade our vitamin D levels, reduce inflammation, or ensure that we get a vaccine sooner than later. CRP. newest product on our list of tests in LabX is a product called NAbs. NAbs stand for neutralizing antibodies. What are neutralizing antibodies? A neutralizing antibody is a subset of the IgG, IgM antibodies, a subset. These are specific to providing protection against viruses or antigens. Now, NAbs is the gold standard in measuring the efficacy of a vaccination. So this test is new because we need this after we get vaccinated. After your first, after your second dose. Typically, we apply this on your second dose between 14 to 28 days after your second dose, if you require a second dose for your vaccine. So NAbs is the gold standard in measuring efficacy, measuring the amount or presence of neutralizing antibodies against the virus. So if you have these neutralizing antibodies in your system, you are immunized. So we have to make sure that the vaccine you receive does produce neutralizing antibodies in our blood so that we know 1 month from now, 6 months from now, 1 year from now, that we are protected with a neutralizing antibody in our blood. So this test here is to measure efficacy and to ensure that we are still protected by the vaccine or we still have those neutralizing antibodies in our blood. So NAbs is a very important test going forward in this pandemic.